Okay.
All right. Hello and welcome everyone. My name is Carly Todd. I'm the Associate Director for New Student Orientation at UNLV, and I'll be your moderator for this session. As a reminder, please remain muted and have your camera turned off throughout the duration of the session. This will help ensure the audio and video quality of the meeting. This meeting is being recorded and will be sent to you along with the presentation slides at the conclusion of this event. If you have any questions, please place them in the chat box on the right side of your screen and we'll do our best to answer them during the session in the allotted time. You can send chat messages to everyone or directly to me. At the end of the summit, please remember to fill out the survey found on the summit website. So without further ado, I'd like to introduce you to Joan. Take it away, Joan.
Thank you. Thank you, Carly. Welcome, everybody. I'm happy to be here and excited to talk through this concept of a safety net to support students through crisis. In my role in retention and support services, I get to work with a group of folks who are, it's really an interdisciplinary group. And oftentimes that's our role, is helping to support students through a crisis situation so that they can continue their education or salvage a semester sometimes or figure out a plan to come back. And so we're working with crisis situations, pre-crisis situations, post-crisis situations quite a bit, which I would imagine many of you folks who are attending this session are as well. So the important thing about this title is the idea of through a crisis. So crisis are, we often talk about helping a student in crisis, and we think about getting them to the resource they need or connecting with the suicide prevention lifeline or getting them to a counselor or whatever immediate need they have. But really, if our goal as educators is that long-term goal of student success and students persisting with their education, our goal in helping a student through crisis should also be an educational focus, right? So as a student is navigating through crisis, it's usually a bit of a journey, like the individual on the tightrope, right? Sometimes they're kind of balancing and moving along, and sometimes they need some support or some help, and sometimes they need to be caught before they injure themselves so that they can try it again. So it's a bit of a journey, and the ideal outcome is that there's some kind of growth or learning that happens. And sometimes that's understanding that they can navigate a crisis situation, learning some skills for future situations where they have to deal with a crisis, gaining some knowledge, understanding some resources or how to access resources. Sometimes it's a deeper level of understanding about themselves or more confidence in themselves in being able to ask for help or to navigate challenges on their own. So here is what we're going to be talking about. A little bit of an agenda for our time together. We're going to go over some definitions about crisis, look at some survey data from prior to the pandemic and post-pandemic, talk about bandwidth and that impact on how students navigate through crises and also how that impacts school. And we're going to spend some time on recommendations for institutions and at the system level. We're going to do a recap, and then we'll have time for questions at the end. So let's talk a little bit about crisis and what is a crisis. So oftentimes a crisis is really like an inflection point, right? That moment of what's going to happen, how do I make a decision? Things have gotten so bad, I need to do something different, but I don't know what to do. Oftentimes it carries with it that a bad choice could lead to a really bad outcome, or there's some really high stakes involved in whatever the situation is, which just adds to the stress and the feeling of crisis. So when you think about college students, just college students in general, what kind of crises do you see them facing? If you want to unmute and share some ideas on that, that would be fine. All right. So let's just think about this a little bit. So there's just the normal things about school, right? There's the things like having tests or having being overwhelmed with homework. There's the things about, am I in the right major? Do I belong here? Do I really belong in college? What am I going to do with my life? Then there's struggling with the life stuff. How do I make ends meet? How do I deal with conflict with the roommate? If it's a new college student, there's things around leaving home and finding a new support network, and adjusting to just life on your own. Another one is budgeting, right? So if students who are on financial aid get their disbursement at the beginning of the semester, and sometimes they have really inconsistent work or opportunities to earn money during the semester, and so they need to budget that money for a long period of time, which is a challenge. So we often see students who are nearing the end of the semester where they're already stressed with, it's the end of the semester and finals coming up, and they're stressed with financial concerns and being able to make rent or just take care of basic needs. So stress is it looks at a lot of different ways, and there's a lot of different layers to it, but it's often the impetus for finally asking for help and resolving whatever the crisis situation is. So it's our opportunity. It's our opportunity as student affairs professionals and educators to help students through the situation. So one of the important pieces of crisis, dealing with a crisis situation, is the assessment piece. Really understanding the totality of the situation. What is the student's perception of the event or the situation? Is this something chronic? Is this something they're always dealing with? Or is it an acute life circumstance, something that just happened, some kind of trauma that we need to address, as well as finding the supports for the ongoing help for the student. An important thing to look at is the student's resources. What are their strengths? What are their support systems? What is their experience navigating through crisis in the past? What coping mechanisms do they have? Sometimes these are helpful and sometimes they're not. What's their overall well-being? And then also looking at the additional stressors. Physical health and financial stability are biggies. We see a lot of times with college students that they don't have good sleep hygiene, right? They just are not very good at going to bed early and getting a decent amount of sleep, or they can be very inconsistent. And we know that has impacts all over the place in terms of ability to function academically and just make good life decisions. So when we're talking about crisis assessment and we're looking at the individual, we also need to be looking at our institutions. We need to be asking good questions of the students, but also good questions of ourselves and our institutions. What's the status of our supports resources for students on our campus? Do we have resources to help students experiencing a crisis? What resources do we have on campus and in the community? What are our partnerships with the community? Are there additional stressors on our systems? And I would say right now, this is super true for all of our systems, right? Right now, we are all feeling a little bit stressed. Probably we have had a lot of things to adjust to. We have budget concerns. I know in my areas, we're super short-staffed. So there's a lot of other stressors on our system that we need to address, as well as addressing the issues with our students. So a big piece of this is really that multidimensional component, and making sure that we are making the right connections to resources for students and for our institutions. So we're going to do a little bit of a quiz here and look at recent data. So give you a couple minutes to go through this. There are, if you scroll down, there are several questions. There are 5 questions. So the first one is, what percentage of US adults will experience mental health conditions in their lifetime? The second one is about diagnosed mental health disorders, students experiencing diagnosed mental health disorders. Oops, sorry about that. Prior to the age of 24, the symptoms, the percentage of students 18 to 24 with anxiety or depression, how many of them seek treatment. The fourth one is about the active mind survey that happened this fall, the percentage of students indicating they're experiencing stress or anxiety as a result of COVID. And the last one is the Real College survey asking about students experiencing housing insecurity. Wow, looks like we are getting quite a few folks through this. Okay, I'm going to end the polling. And we can look at the results here. So the first one, the percentage of US adults who experience a mental health condition in their lifetime is 50%. So, that may be higher now, right? So that was pre-COVID. I would imagine that it is probably higher now, but that's the general statistic, is half of us in our lifetime will experience a mental health condition. So it's not uncommon. I think that's the point of that one, right? It's not uncommon to have a mental health condition in one's lifetime. The percent of students diagnosed with mental health who end up diagnosed with mental health disorders who experience symptoms by age 24 is actually 75%. This is a really important thing to be aware of as colleges, because the bulk of our student population is in that age range where they're probably going to have their first symptoms of a mental health concern. And so it's really important to be aware of that's really likely that a student who's going to have a significant mental health concern will have some experiences during their time in college. This is really, I see 100% of you went with the 33%, and that's absolutely true. So only about a third of students will seek treatment for their mental health or anxiety, their depression or anxiety treatment or concerns, which is really kind of unfortunate, right? Because early treatment makes a big difference in terms of long-term outcomes. Active mind survey, the percentage of students who indicated they had problems with stress and anxiety, absolutely right, 89%. So that has really gone up during COVID. And Real College survey, 48% of students have indicated that they experienced housing insecurity during this time. So that's a lot of students who really have experienced some challenges around basic needs. And what's more basic than housing? Well, food, I guess. So looking at a little bit more deeper dive into the effect of the pandemic and the Real College survey, as you can see, all kinds of insecurities are higher, right? Food insecurity, 3 in 5 students experiencing a basic needs insecurity, and it's unequally distributed. So our Black students are experiencing more challenges with basic needs insecurities than our white students. Lots of impacts from COVID, lots of grief and loss around families and family members and friends who've experienced COVID or even died of COVID. I think the thing that I take away from this, it's important, all of it's important, but one of the most glaring things is that 52% of the students who were facing basic need issues did not seek services, that they didn't know how to reach out to get resources. That's hugely important. One of the reasons why this is really important is that from the crisis that we talked about earlier, and I saw in the chat that people put in other important things like caring for family members, caring for older family members, younger family members, even caring for themselves when they're sick. So all of these challenges impact a student's ability to function academically, but it also impacts their ability to deal with a crisis. So their mental bandwidth is affected by all of these things. Mental bandwidth is really our ability to focus, our ability to make good decisions, to problem solve, to plan, to sustain our attention on something and to exert self-control. And it's a limited resource, we only have so much mental bandwidth. And when it's taxed, we're not as able to stay on task or to make good choices, especially in high stakes situations. There's been a number of different studies that have shown that when people are faced with high stakes situations, they make oftentimes a short-term decision that maybe feels better at the moment than the long-term decision that would really take care of the situation into the future. So that's an important thing to keep in mind as we're helping students through crisis situations, is that we all have that tendency. We all have that tendency to make what appear to be not very good short-term choices, but because of the taxing situation on our mental bandwidth, that's what we do. Strain in one area can spill over to strain in another area, lack of self-regulation. And this is especially true when we're mentally exhausted. And, students are mentally exhausted a lot anyway, but now even more so. So mental depletion takes a toll on academic performance. And just to share a little bit of research, a study that we did, we participated at TMCC in the Healthy Minds survey in fall of 2020. And 84% of our students who surveyed said that within that month, prior to the survey being administered, which was October of 2020, they had one or more days where they felt that emotional or mental difficulties impacted their or hurt their academic performance. So we know this makes a difference in terms of student success on our campuses. So question, how do we address mental bandwidth, right? What campus resources do we have to address mental bandwidth? We know that we have this finite capacity. We know that students are struggling with meeting back in basic needs. They're struggling academically. They're trying to address emotional or behavioral issues. So there's a myriad of things going on that's going to impact their ability to make good decisions and to resolve their crisis situation effectively. So what supports can we build into our campus communities to address some of the concerns about mental bandwidth, to remove some of these burdens that are going to be helpful both for academic success and overall wellness of our students? So if you could take a minute and put in the chat some of the resources or services your campus has to help students address bandwidth issues. Some of the things that we have at TMCC are a food pantry, emergency scholarship funds. We have safe spaces where students can go and hang out. We have, Wizards Warehouse, absolutely. WNC has a food pantry as well. One of the things that we do, we know students are particularly stressed during finals, and so we partner with our Student Government Association to bring dogs on campus to help decrease some of that stress back when we were on campus. Hopefully next fall we can do this again. Absolutely, counseling services, health services, psychological services, all of those things are helpful. Emergency services, all of those things are helpful. Oftentimes outreach activities that help students to connect with other students and engage with other students are helpful as well in addressing a lot of those issues. Tutoring services, that's another one. Encouraging students to talk with faculty. Events during finals week, pet therapy, lots of fun events, that's absolutely true. Encouraging students to have times for self-care, times to get away from the academic stressors are all really, really good ones. What about community resources? Are there any community groups that anybody partners with to help expand the resources available to your students? So one of the things that we have that's available to all colleges is we work with the Department of Welfare and Social Services to have SNAP ENT, which is the SNAP or food stamp benefits, which actually right now students can continue to get food stamp benefits when they're full-time students. Under normal times, you can only continue to get food stamps if you're participating in an approved training program, and colleges can work with the Department of Welfare and Social Services to have SNAP E&T, which allows students to continue to get food stamps, SNAP assistance while they're in school as a full-time student. They don't have to be working. And it also then opens up access to some other resources and support. So that's a really important one. We work with the Crisis Support Services of Nevada to have a campus victim advocate. So students have a community resource to go to if they're experiencing interpersonal violence or trauma or bullying or have been sexually assaulted, which is really, really helpful that they have this additional resource to go to. So we're often looking for other resources to expand the services that we have available for students. And it sounds like many of you are doing the same thing. So a year into the pandemic, so just this survey was just done in March with over 2,000 students. 65% of the students who responded to the survey indicated that they have poor or fair mental health. That's a lot of students who are feeling some challenges around mental health. 63% of those who are reporting poor mental health grade their college's mental health and wellness services at a C or lower. So those who are in most need that are trying to reach out to their mental health services are coming up with not feeling the support that they need. 47% indicated that they could use more support than their college offer, but only 15% engage with college offered counseling services. And this is something that we see consistently, is that students don't always take advantage of the resources that are out there. We saw that in the Real College survey. Half of the students didn't apply for resources that were available to them. Only 15% of the students engaged with counseling in the past year. We do an annual outcome survey for our students, our graduates, and consistently our graduates indicate that they are not aware of, half of them indicate they're not aware that we have counseling services on campus. And we feel like we do a lot of outreach. I don't know if you guys feel that way or not, but we feel like we do a lot of outreach, and there's still so many students that don't know that we have resources available to them. So that's a big challenge to help students understand those resources and connect to resources. Some of that, is related to stigma. So using resources, some students may feel like they don't, there's other students that need it worse than they are, or they may feel that others may look down on them for getting resources. A lot of the research around stigma indicates it's not so much that the individual feels stigma about getting help or seeking resources, it's that they fear others will view them differently about that. So they wouldn't feel look down on anybody or feel any differently about a peer getting a resource, but they feel like their peers would look down on them for accessing a resource. So let's spend the next bit of time on the important stuff, right? The resources, the recommendations. What do we do about all this? We know it's a problem, so how do we help? And so these recommendations are pulled from a variety of resources and some of the things that we've done in my area at TMCC. I have the resource links at the bottom there, the great resources. These are really good, good articles, good ideas for helping to improve services to students on campus. So the first one is being really clear about providing information on when help is available. So sometimes we're not super clear on that our counseling services are only available during these periods of time, or during work days from 8 to 5, or even in our case, we don't have counselors really seeing students until 8:30 or 9, and last appointment is like at 4. So students really have a more limited window of seeing a counselor than they might think when they look at our website. So by not having super clear information about availability, we can set up expectations that we are unable to meet, right? Students then think that there's more services available than there are, and that can set us up and our students up for disappointment, to say the least. Another thing is to assume all students need support. There's back to the how many students actually access support, not only a percentage of those who really need it. So if we go into building resources and supports with this safety net idea, so it's this big safety net that can catch all these students on their tightropes, then we're more likely to really be able to help students who need it when they need it. There's lots of ways to build resources in that way. Some of the things that you put in the activities that you're doing to address basic needs, food pantries are really good. Activities during finals, stress reduction activities, screenings, providing access to screening tools, doing campus-wide screening activities are another way to help destigmatize asking about mental health questions, and also to help identify students that need more assistance and connect them a little bit easier. Providing immediate help options. So there's a couple of strategies for this. One is putting the suicide prevention number on student ID cards. There is a bill in the legislature right now. I don't know if it passed, I kind of lost track of it, requiring that. So that's helpful. Then students, if they have their student ID card, they have access to the crisis support services number, which is super helpful. Putting that information on your websites and information to students is also very helpful. Another thing that we've done in our counseling center is we have an on-call counselor. So the on-call counselor knows that their role is to be the person to respond when a student needs help right now. Again, it's only limited to our times that we have counselors on campus, but that's been really effective in helping us to be able to address a student need when a student needs that support. So immediate help options. Private counseling spaces, especially now when we do so much of our counseling through telehealth, right? Tele opportunities on the phone or video conferencing. Sometimes our students are not in spaces where it's safe to disclose or where it's confidential. And so helping to provide private spaces for them to access counseling, even if it's through video conferencing or a phone conversation. So identifying places on your campus where students can go to take these kinds of meetings is really helpful. We've set up some kiosks on all of our campus locations to help be that portal for virtual conferencing for our students that are in private spaces. Being transparent about care models. So we don't provide therapy. We provide counseling, and counseling is different than therapy. We can help you navigate through crises. We can help you figure out how to be successful at school. We can give you all kinds of great tools and resources and strategies for improving your life and your daily functioning. But for our students who have significant mental health concerns, we can't provide therapy for them. So we have a contract with UNR Med School for some of our students, we're able to refer them over there for assessment and med management, which is helpful. Incorporating peer training, support groups, training faculty and staff. Again, that goes back to assuming all students need support. So the more our campus community is able to identify students that need support and connect them to resources, the better. Get student input about how your resources work. Diversifying counseling, your counseling staff when possible. Being aware that not all students come from the same background, and being open to learning from them about their life experiences and what kind of supports are going to be most helpful to them. is really important. That whole being, having that presence of cultural humility is an important thing. I've mentioned this many times, partnering for resources, and a biggie, don't ease up post-pandemic. Oh, I see a chat. Oh, okay, another meeting to attend. So some strategies system-wide, and I loved Chancellor Rose's conversation this morning because she really talked about that. She really talked about the idea of promoting well-being, promoting a culture of well-being, really looking at our own self-care and the self-care of our colleagues as well as for our students. But it's even bigger than that, right? Supporting early childhood education, addressing the times when people end up being exposed to trauma, and helping to make sure that there are resources available during that critical early childhood period and that K-12 period where people can address issues and as they arise. Community and neighborhood supports, mental health resources in communities, supports in communities are really important pieces of this. Our students are only with us for a portion of the time, and and especially for community colleges, they're only there for a portion of their day or a portion of their week. A lot of the resources and support needs to come from the community. So ensuring that we have good relationships with our community and know what those community resources are is super important. Health insurance coverage, right, for mental health and substance use treatment is important. That culture of well-being, campus-wide, system-wide, making sure our services are culturally relevant. This is a biggie, policies that support students seeking treatment. So sometimes students have to step out of school to deal with their crisis, and then they can step back into school. How easy do we make it for students to do that? That's a really critical piece. Making sure that we're doing appropriate outreach and resources to students who are marginalized or vulnerable or least likely to seek services on their own. Sharing best practices with each other, that's super important. System-to-system agreements in places where resources exist is really helpful, and leveraging technology to communicate, collaborate, and provide outreach. We use Starfish, which many of the campuses have, to communicate with students. We're working on an intervention inventory, which makes it easy for faculty to find the interventions that they can refer students to. This helps us to have a more cohesive system in helping students because we can collaborate and see who else the student has talked to and be able to really provide a better care, that safety net of care involving lots of partners for students. So really the safety net is about assessing resources, building capacity, and increasing awareness on the institutional side and seeking student input. On the student side, it's really understanding the full nature of the crisis, identifying what their assets are, which helps to give them hope too, right? And it also helps to help them take ownership of solving their problem so that later they can solve their problem on their own. And connecting with resources, building, helping them increase mental bandwidth, building a system of support and following up, because we're helping them through. We're not just helping them in the moment. And now we can open it up for questions. I'm going to stop the share so I can see folks. And if you want to chat questions or share resources, that would be awesome. Well, so one of the things to consider is I always go back to how can we help students connect to the resources they need when they need it. And one of the things that we're trying next year is we're organizing our retention and support services resources into advocacy and resource hubs. So we're co-locating disability services, counseling, our reentry or educational partnership resources, our food pantry, and our career resources together in these hubs at our 3 campuses, and using the kiosks to facilitate connections between students. And we're hoping that that helps, because it's kind of back to that, the idea of there's no wrong door in. So if a student comes in because they need food resources, so they want to access Wizards Warehouse, then we can help determine if there's a broader crisis situation we can assist with. So great question about community connections. Yes. You know, the best path forward with the endeavor of community resources is, so for us, it's been on a case-by-case basis, right? So we've built relationships with other community resources based on a need for a student and identifying what resources might work, and then reaching out to that resource and building it. And so now the next thing is really that more system to system one. It has to be purposeful. It has to be, you know, you have to have actual work that needs to be done, and to be a little bit flexible. So sometimes community resources are not the same. They don't function under the same rules that we do. And so we have to sometimes step out of our world and look at it from the perspective of the community resource, and to identify the win-wins. So a win for us is that the student graduated. A win for a community agency might be that the student got a job. So we need to figure out, that's still a win for us, right? If the student gets a job, because then that student graduates, gets a job, they're successful, then they're a great alumni who might be able to give back to our institution through mentorship or other resources. So identifying those common wins, it's a process, and I think that us working together, institutions working together, and reaching out to community agencies is another pathway forward. I think we are about out of time. Is that right?
No. No.
Go ahead. Terry, did you have something you wanted to say?
No, sorry.
Okay. Any other questions?
You still have a little bit more time.
Oh, okay, good.
To you if you feel good. Yep.
Good. So we go to 11.
11:20.
Okay, so good.
Or whenever you're ready.
All right. So I would love to hear what is working for some of you folks, right? What are the things, the innovative things, the things that you've seen that have worked with your campus to expand resources to students and to address the crisis situation students have? All right, then I'm going to throw out more stuff. Ongoing outreach to teaching faculty, yes, making sure they're aware of what's available to students. So doing professional development workshops, training to faculty about the resources that are available, peer mentor programs, that's been wonderful. Oh, and that's excellent for early alert for students. I love that, Mary. That's a great strategy as well. Encouraging faculty to put syllabus statements that say something about seeking resources and what resources are available. Making things accessible virtually, group advising virtually. Oh, that's a great idea. Support groups are also really helpful. We have a grief support group next week that we're hoping will be useful for students. That's another thing, thinking into the future. So that's one of the things we've heard a lot from students, is that they're dealing with grief on a lot of different levels. There's a lot of different ways they've experienced loss in the last year, and addressing grief has been super important actually for our faculty as well. So we're looking at increasing the resources we have for dealing with grief as we go forward. So virtual access is helpful. And that's one thing that I think was a surprising positive about the pandemic, is that the virtual access has really helped to increase equity in many ways, so that that student who is a working parent and can't make that journey to campus for that appointment can connect virtually, you know, in their lunch hour at work or when their kids are taking a nap. And I think that we've seen an increase in students who are connecting that way. The other thing we've done that's been helpful in terms of leveraging resources on campus that we hadn't before is Canvas. All of our students are in Canvas now, right? They all have something that's online. And so we created a Canvas class called Lizard's Lounge, where we put some discussion posts about things that students may be struggling with or want to share and engage with. And we have a counselor that monitors that. And then we also have post resources there and videos and links to some self-care and other information. And that's been amazing. We have hundreds of students who are interacting through our Canvas Lizard's Lounge option. Yeah, I agree. There's a comment about the Zoom option going to remain as an option for seeing advisors. I agree. Same with us for counselors and for our DRC folks. The Zoom option is really, it's really a nice enhancement. We were trying to do it prior to post-pandemic, but you know, we didn't really know how. It was a struggle. It wasn't part of our normal functioning. And so now I think we're much more comfortable with that. And students are much more comfortable with that. And it's a great enhancement to what we're able to offer for students. Another thing a lot of campuses have are like threat assessment or behavior intervention or care teams that really work to identify students who are of significant concern and get them to the resources and support they need, and to communicate as a team about what that care is and what that help is for that student, and to monitor that student. That's another excellent way we build a safety net. So the safety net even has safety nets, right? So sometimes it's a matter of having a layered approach to supporting students and identifying what their needs are and connecting them to the resources that would be helpful to them. Another thing that we have done in the past that we're hoping to do in the future, because we don't have health services on campus, is working with healthcare providers to do immunization clinics on campus and STD testing on campus and things like that, legal clinics on campus. We can't provide them on an ongoing basis, but we can provide them, you know, a couple of times a semester where students can access these resources. We also bring in the people that can help students sign up for insurance and for public assistance, Medicare, you know, all of those kinds of things. Resource fairs, all of those things that we've done in the past have been helpful for getting students connected to the resources they need to be successful. I feel very hopeful that, and it's again, you know, a silver lining of the pandemic. For those of us in student services and student affairs have known for some time that our students struggle with mental health issues, our students struggles with meeting basic needs, and all of those things impact their ability to be successful students. And we aren't going to have successful students without addressing some of these issues. And it's just been increasing. We've known that for years, you know, but now it's become common knowledge it's reached the crisis situation. It's reached that decision point of these are all real issues, and they're real for our institutions, they're real for our students. And now we are at that point of reaching out and asking for help and making those connections so that we can get through this crisis and be healthier and stronger and more capable of navigating crises as we go along. And I think that's super, super wonderful. And the benefit, and sometimes the benefit to having access to fewer resources is that you tap into the resources you already have. So really looking at what do we have within our campus communities that we can strengthen, that we can build, that we can collaborate with to really serve students on a broader level. We started our food pantry and our student scholarships, our emergency scholarships, and then also a program to help students access Wi-Fi, really because we started a student resource committee. We discovered that several of us were dealing with the same kinds of issues, and we thought, well, let's talk together and see what we can do as a group to resolve this. And so from that group has blossomed a number of different support services for students. And it was just because we made that opportunity, we made that time and that commitment to talk together and to plan and to institute some help for our students. And so back to Mary's question, about community resources, inviting community members, community resources to groups like that, and to say, how do we work together? What are some things that we can do together to help our students who are your clients or your community members or your parents? How can we work together to best facilitate the building of supports for our students? Any other questions or comments? Okay. Thank you all. I appreciate your participation, and hopefully there was something useful and helpful in all of this. Thank you very much.
Thank you so much, Joan, for the great presentation and the really important work that you do every day. So to all the attendees that are here, make sure to join back to the Summit website for the session that begins at 11:30. And just happy Friday, enjoy the weekends and enjoy the rest of the summit. Thank you so much.
Thank you. Bye-bye. Happy Friday.